And what we're seeing now is basically the highest level of occupancy that the sector's had in many, many years.
Hospital overload, where nearly 1 in 6 patients don't need to be there but have nowhere else to go. I'm Christina Howard, and today the Ontario Hospital Association painted a grim picture of what the future holds for the province's hospitals if they don't get a massive cash infusion.
In many cases, without increased funding, a reduction in staff might be an unavoidable last resort. $401 less per person.
That's Anthony Dale, the head of the Ontario Hospital Association, making a pre-budget presentation asking the government for a 3.45% increase, or about $656 million in additional funding for hospitals. And that's just to keep services the way they are. Crowded emergency rooms, overcapacity, and long wait times. If they don't get the funds, he says there will be consequences.
Well, it's going to vary hospital by hospital, and it's really important that the people of Ontario know that hospitals exist to deliver services, so they're going to do everything humanly possible to make sure that access to services are maintained and that nothing happens to the workforce. But no one should be under any illusion either that there wouldn't be very difficult trade-off decisions in a lot of organizations too.
Ontario already has the fewest number of acute hospital beds per 1,000 people. It's a 36% reduction in beds since 1990, while the population of Ontario has grown by a whopping 39%, resulting in the hallway healthcare all too many people have experienced.
On any given day, we have 4,665 alternate level care patients in this province. So this was just in the last month of November. What this does is ultimately backlog patients waiting in our emergency departments. These patients are waiting for placement in home, in community, or in long-term care facilities.
The government has already committed to building 6,000 new long-term care beds, but those homes and beds will take years to deliver. And while hospitals are asking the government to streamline how it delivers much more cost-friendly home care without a surge in funding for hospitals, Station Walla says patients will start to feel even more pressure in their hospitals' halls.
At the end of the day, staffing is the largest proportion of our budget, and when we're in the crunch, that's where we put our dollars. So it will put pressure on the emergency departments, it will put pressure on flow, and it will further backlog the system.
Now, all of these asks are being made while the province embarks on a period of austerity. Finance Minister Vic Fedeli has already said that he aims to find 4 cents of savings for every dollar the province spends. In this case, the hospitals are asking for even more cash. So it's not clear if they or the patients will get the remedy that the Hospital Association says they desperately need. Budget submissions are being accepted by the province until February 8th.